Hi, my name is Riza Maloney. I'm in Adult Health 1 class, and then I'm going to demonstrate a IV insertion for today. And I'm going to walk into my patient's room, knock on the door, and introduce myself. Hi, sir. My name is Riza, and I'll be your nurse today. And then I'm going to match the identification of the patient to the armband, and then it is matched. This is Mr. Zellner, and then I'm going to explain to Mr. Zellner what the procedure that we are going to do today, which is the IV insertion for his antibiotic therapy. All right, Mr. Zellner, I'm going to ask you which one is your non-dominant hand and non-dominant arm, and then he said this is his left arm, which non-dominant, and then I will make sure that it's not gonna interfere with his ADL's the schedule of ADL for the day. And then I'm going to check his arm distally to proximally, all the way from his hand, and then palpating his vein. Make sure the vein is bouncy, soft, and resilient. All right, I found my vein right here. All right, I'm going to wash my hands, washing my hands, and then putting my gloves on. Alright, gloves is on, and I'm going to put the tourniquet on above the elbow, about 4 to 6 inches above the IV puncture. Alright, using the easy release method. Oh, excuse me. Alright, the tourniquet is on, everything's good, and then I'm going to check his vein again, or it's still there. I'm going to clean the IV side with this alcohol scrub, and then I'm going to scrub it, scrub. All right, it is clean. And then while I'm waiting for the alcohol to be dry, I will make sure that I will attach the INT with the flushing tube. Alright, flushing tube and INT is attached, and then clamp it, and I'll make sure that this is still sterile. It is sterile, and then this is clean already. And then I'm going to insert the IV catheter using the 20 gauge catheter, and then 15-degree angle with bevel up. I'm going to insert it. Catheter is on, and I'm going to advance the catheter. I'm advancing the catheter, and then as soon as the catheter is in, I'm going to press the vein and release the tourniquet release. Everything is released, and I'm going to attach the INT tube. INT tube is attached, and then I'm going to advance the catheter, and then press the vein, attach the INT, and then I'm going to aspirate, and I see blood in return, and then and I'm going to flush it 10 milliliter using the going and stop method flush with 10 milliliters. Okay, go and stop, and go and stop, and go and stop. Alright, and I'm going to clamp it, unattach the INT. This is out, this is clamp. Hold on, I'm going to clamp it right here. It's clamped, everything's good, and I'm going to use my tegaderm. Before that, I'm going to clean the IV around the IV side, because I see some blood, and I'm cleaning it. Clean around it. This is clean, and I'm going to use my tegaderm. And I'm going to tape it on. This is tape. And before I tape this, I will make sure that I already put my name, my initial date, and then the size of the catheter, and then that is clean. And I'm cleaning everything. Everything looks good. Taking off my gloves. Oh, I'm sorry. Before that, I should have make sure that nothing is out of the way. So I would just want to attach this. Make sure it's not going all over the place. Everything's good. The IV already inside with 20 gauge IV, and then I'll have to make sure that I will tell the Mr. Zellner that I will come back. Everything looks good, and then I ask him if he has any any disturbing feeling, and then like if he feels any uncomfortable feeling around his arm, and then he said that nothing is feeling everything's feel good, and then I will let him know that I will be back in about 15 20 minutes to check on the IV side. We'll make sure that there's nothing bad going on around the IV side. All right, and that's my demonstration. Thank you.